Did you know that there are research-based rules to let us know if we need an x-ray for ankle or knee injuries? My name is Dr. Brad Conder. I'm owner of On-Site Focus Physical Therapy. And I tell you, I wanted to kind of cover something that oftentimes I talk to HR directors or people on site that are safety managers that are trying to help people when they have trauma or injuries to their knee and ankles decide if they really need x-rays. Now, obviously, x-rays are always okay to do, especially in the case of trauma. And trauma is probably the one thing when I'm on site that if it requires an x-ray or a follow-up with a doctor, it's never a bad idea to do so. But oftentimes we can use these ankle and knee auto rules that are proven in research to kind of see if an x-ray is needed. One of the biggest parts actually is two things: palpation of the bones, and then also whether they can walk or not. So, for example, if you're going to have an ankle injury and you're not for sure if you need x-ray, a lot of times the bony prominences, meaning like the malleolus of the bones, so we're looking at the in and outside bone parts and also the heels. If we can touch on those and kind of not have super sharp shooting pains, oftentimes that might be one of the rules to not need actual x-rays. Another thing is if they can put weight on it. But same thing with the knee as well. If they can actually take 4 steps, even though it might hurt, if they can do it, it usually doesn't indicate necessarily x-ray. Same thing with the knee. If you can walk on it, or if you can bend the knee past 90 degrees, that's all another rule too. So the good news is there is rules. There are ways that we can kind of help make medical decisions for you on site. That way you can kind of feel more confident as far as what the next step is for your employee. It's always one of the hardest things to do is what should we do next? Sometimes we default to kind of go into like ER or doctors, and that's the way patients think because they don't know what else to do. But oftentimes we can give you that advice to kind of help you make those decisions. Again, this is just pure medical advice as far as from a physical therapist. Never feel bad to use the expertise of a doctor or x-ray because that's what they're there for. So hopefully it's helpful. If you need more information or you would like to kind of talk more about some of these things that we can help on site, email me at brad@onsite physical therapy onsiteFocusPT.com or call me at 502-509-3136. Stay safe. Hope to hear from you soon.